much of an appetite, and they're very picky eaters. So, and also they have poor ability to smell. We know that this sense of smell is actually important because it actually has to do with our ability to approach or withdraw. So we generally will approach something that smells really good and will withdraw from things that smell very bad. For example, being able to determine if there's trash that needs to be taken out. That type of function, or not being able to determine that, is not a good sign as far as your brain function. And we know that the right nostril generally will go directly into the right hemisphere of the brain. It's a direct connection. The left nostril will actually go into the left side of the brain. So we can actually use that as a test to see which side are they unable to sense, which can clue us in even as to which side of their brain is malfunctioning or under firing. So generally we can have problems related to hyper and hyposensitivity to smell. And the other thing having to do with smell is that, if you can think back to your first experience, say with a love relationship, one of the things you may remember is how that person smelled, or if you went to a bakery and your first experience going into a bakery, what that smelled like. We actually tie our emotions to those different smells. So if the child can't do that, it can actually affect a lot of their ability to tie their emotions to things, which can create a lot of problems. If they don't know the difference between right and wrong, they can't inhibit their emotions, and they can't feel their emotions, then we know that that can create a lot of problems in the future. So, movement and thought are linked. If we have uncoordinated movement, actually creates uncoordinated thought. This binding is due to stimulation from different joint receptors that we have in our body that send information to the cerebellum. The cerebellum is basically our balance center. It's also the richest area it's actually the most oxygen rich area of our brain and oxygen dependent area of our brain. And it's the initiator of all human learning, cognitive or social. So that area actually has to be strong so that it can send information up into the higher areas of our brain. The cerebellum feeds to the thalamus, the prefrontal cortex, and basal ganglion and amygdala of our brain. This develops the prefrontal cortex, which inhibits the limbic system. Appropriate social perception and interaction is then developed. So, for example, if we can't move properly as a child, if we can't start dampening those primitive reflexes and really laying the groundwork for those neurological pathways, if we can't do that, if we are exposed to different toxins, if we have had a poor diet, if we've had different illnesses that, for example, parasites and bacteria and all of those different things, it can actually inhibit the ability to form a healthy brain. And that's where this whole imbalance comes in. Okay, so there's actually 3 different types of ADHD. Type 1 affects the dorsolateral prefrontal cortex. So it's actually naming the area of the brain. It's the right brain, the dorsolateral prefrontal cortex. That area, when it's under functioning, creates poor concentration. The child is distractible. They have poor attention, poor motivation, and omission errors. So we know that it's tied directly into that right hemisphere in the dorsolateral prefrontal cortex. Type 2 affects the orbital prefrontal cortex, which is also in the right hemisphere. Impulsivity, hyperactivity, inhibition problems, and commission errors. Type 3 actually combines both, so they exhibit both different types of characteristics. Common medical interventions. Well, generally, most of you are probably dealing with this. You've probably may have been to your doctor, maybe your child's on medication, and you know that the effects that you get from the medication are limited. They have side effects, and they have a risk. There's been no research trials for all medications over the past 50 years. All medications have been used off of the label. And again, it's not fixing the imbalance of the brain. It's purely used as a behavioral control. So, when the medication's discontinued, the problem can continue to present itself. Also, the problem with medications is that this can be a drug, that can actually be a gateway drug for these kids. So if they're utilizing prescription drugs, as they become a teenager, they can be at higher risk to develop, a tendency to use drugs. Also, we know that, if they don't learn how to, if they don't strengthen their brain to actually get those pathways developed, they're never going to be able to understand, what the causes they make are going to be, what effects they're going to have from the actions that they make. So this is a huge, huge problem with, with what's going to happen to them in the future. If they can't control their emotions or impulses, they can be at risk to go into the penal system, and also it can really affect their ability to live to their potential. So how do we correct the imbalance of the brain? Well, first we have to localize really the lesion or the weak area in the brain. Is it the right hemisphere or the left hemisphere? Is it the temporal lobe of the brain? Is it the parietal lobe or the cerebellum? Or is it a combination of a couple of those different things? So I actually do a thorough examination to determine where those weak areas are, as well as an interactive metronome assessment, which I'll talk about in a minute. Then we have to find the weak area and actually activate it. How do you activate those weak areas? How do you activate the brain? How do you form new connections? Well, you use visual stimulation, through the eyes, auditory stimulation, vestibular stimulation, balance, for example, balance and proprioceptive type of exercises, olfactory stimulation, so through the nose. We also use rhythm and timing exercises. That is specifically with the interactive metronome, which tests and tracks your child's ability to be able to move their body in time to a sound. That actually can tell me a lot about whether or not your child has a left or a right hemispheric imbalance, as well as how severe is it really. Because generally, a child who has a right hemispheric imbalance is going to be very impulsive. They're generally going to act or respond way ahead of time, way before the tone or the sound. A child with a left hemispheric imbalance is usually going to be slow to respond, so they may respond late to the tone or sound. So then we actually use that metronome to actually stimulate the different pathways again. And also that affects the cerebellum, which again is the best way to really get to the higher levels of the brain, so we can stimulate movement, use the body to actually stimulate the brain. Unilateral adjusting. Well, I'm a chiropractor, so why not use, one of the best tools that I have to actually gently I use an instrument to gently stimulate the joint receptors. We have all these different little receptors in our joints that actually send information to our brain. And those joint receptors tell our brain where our body is in space, so our position sense. So we would want to actually stimulate one of the sides of the body. If we were to adjust the left side of the body, for example, that would stimulate the right hemisphere. If we were to adjust the right side, we could stimulate the left. So we would want to do very specific instrument adjusting to actually stimulate, that weak hemisphere. We also may use something like, for example, vibration or heat or cold to stimulate those different pathways. Also,